I don't talk to my doctor about obesity because I don't, as much as I like him on a number of other matters and trust him with, life-sustaining and both proactive and reactive responses to medical conditions. Obesity is not one of those conditions that I would entrust to his care because it's very much a blame and scare you tactic or approach. You're going to die. The only reason you're still living is because you're in your 30s or you're in your 40s. So I continue to go to him for other matters, but when it comes to my health conditions that are connected with my weight, I have a completely different network of support. Dr. Macklin, I was at your talk that you did for Obesity Matters down in Toronto, a couple months ago, and I've heard Dr. Wharton speak. I come to Obesity Matters events. I do take Ozempic myself, and so I speak to a separate doctor that supports the administration of that medication to help with this genetically grounded and lifelong chronic condition. But my family doctor, my family practitioner, is not part of my system of care.
So Dr. Macklin, this is a problem. So I need to flip the question to you now. Why don't you talk to us a little bit about what the healthcare profession is doing for people living with obesity?
Thank you for that feedback, Andrew. That was very, very moving and fascinating that there's almost this dichotomy. There's my family doctor who takes care of my upper respiratory tract infections and anything else that comes up, but obesity really isn't discussed, and that they share with you a shame and blame and scare. So really almost like two different doctors, and one that you'll speak to and one that you'll look elsewhere for support. And so currently, we know from good data that physicians are not educated or sensitive to the processes of treating obesity. Personally, myself, groups like Obesity Matters, groups like Obesity Canada, sponsorships through Novo Nordisk, we are looking to take the very first steps at the primary care level, which is teaching doctors to lean in and invite patients to consider that if they struggle with weight, they are struggling with a real medical condition that is brain-centered, genetically conferred, progressive, strongly environmentally influenced, not their fault, not about dieting or exercise, and something for which effective treatment exists. Would you consider? And if so, I can hopefully share some information that could be helpful for you, all the way from information to, in fact, even effective treatment. So we're not there now, which is quite remarkable, because this is, of course, in some ways, the leading preventable cause of death and disability on our planet. Excess weight can affect someone's health and quality of life so adversely, in addition to being an object of stigma and bias and discrimination. And so please be patient with us. We sometimes call this the grand apology on behalf of healthcare practitioners. Sorry, we have not been there, but the role of physicians like myself and Sean are to, almost in a trench-like war fashion, doctor by doctor, one at a time, see a slow transition amongst physicians and understanding and respecting those who struggle with weight, inviting them to consider discussions and that effective treatment exists, and most importantly, that what they struggle with is not their fault. So bear with us, please.
Would you give to people in this room who are getting pushback from their doctors or feeling ashamed or shamed? Can you give them any advice as to how they can get the proper care that they need within that kind of relationship?
It's a very good question. Right, because in a way, we can imagine that there are individuals without the self-advocacy skills, for whatever reason, that make access to support much more difficult. And so my advice to start with, most certainly, would be please consider that your struggle is valid. We started our clinical practice guidelines. It's the lead on our guidelines, describing the challenge of internalized weight bias. And internalized weight bias just means that the message is that this individual living with this real condition has heard all their lives has become internalized to the point where they themselves believe that theirs is a failure and they're not strong enough and that they're different and that they're lesser. So the very starting point of answering that question would be to start to recognize that internalized weight bias exists, and that really the antidote to it to start with is to understand that the condition that you struggle with is real and valid and genetically conferred and brain-centered and progressive, and not a flaw in character and not a lack of willpower. That's the external messaging that's become internalized, and that treatment does exist. and that we are far behind in the medical community, the RD, the nursing community, in being able to provide. You're not going to have at every corner now access to effective treatment, but it does exist. And so that would be the starting point, I would suggest, is recognizing that if you do choose to advocate for yourself in this healthcare system that doesn't support you, you're right to do so, and that it is valid, and that your condition is real. And so one of the two participants is wrong if you're not receiving valid care, and it's not you.